Today we're going to talk about constipation. And what is constipation? As such, common man term, it is difficulty in passing motions. So a lot of myths, a lot of facts and that has to be clarified about constipation. A lot of people have a lot of belief. And especially in old age, this constipation becomes a big issue for the old age people and the retired people. Especially because they do not have any other work, they basically think about their bowel movements. The first common myth that all of us come across is that we have to pass motion every day. That is not something which is absolutely necessary. Every individual has their own bowel movements. One person can have 2 or 3 bowel movements in a day. The other person may have a bowel movement once in 2 or 3 days. This all depends upon the individual, how they are actually developed, and that is the habit formation. So not necessary that you should have a bowel movement every day. It will be good, but it is not abnormal. Second is that, sir, only if I drink coffee or tea or I drink some hot water, then only my bowel is moving, sir. Otherwise, it is not moving at all. And that is also quite normal, because that is something called the gastrocolic reflex. Whenever you drink something hot, it stimulates the stomach, and then that stimulates the colon, the large intestine, to move, and then we have a bowel movement. So to have a stimulant, that is quite normal, and that is also yet again habit formation, and it is not abnormal. And many people say, sir, when I start off in the morning, when I want to go to work, I pass motion immediately after waking up, and after eating again I have to pass. So that again, if it's been a common habit, it is normal only, because it's not like a tap. When you open the tap, everything gets evacuated. Many people expect like that, the bowel movement like a tap, everything gets evacuated, then it closes. So 2 or 3 times also when you are actually passing motions, incomplete evacuation, if it has been for a long habit formation, it is okay. And then other people have some belief that whenever you're taking medicines for passing motion, that is called laxatives. So I've been taking laxatives, is it all right? What is the side effect? So what we have to understand is these laxatives 99% are locally acting. They do not have systemic absorption, so they don't have much side effects. Basically, they work mostly on the intestines. Of course, when you have a normal bowel movement by natural methods, by eating a lot of fiber and food and water, that is good. But when at all you have to have a laxative, the problem is long-term dependency should not come. Of course, you should try to reduce the laxative use, but then again, it is not alarmingly something you'd have to be alarmed that it is going to cause a lot of side effects. And a lot of people believe that there are only fiber. What is the fiber? Everyone says, sir, I'm taking supplements, I'm taking only fiber. So that will not causing bowel movements. Only fiber is not going to cause your bowel movements. You need a lot of what most important thing is you need a lot of water, you need fiber in your food, and you need physical activity. A lot of people never go for walking, never do any physical activity, but they think that without doing this, that the bowel movement is going to be normal. So physical activity is definitely going to help you in your digestion and a bowel movement. So what are the other common causes that we miss out? Because what can cause this constipation or decreased bowel movement is diabetes. The common entity that we come across, diabetes can affect the nerves which are going to the intestines also. So some people may have constipation, like the diabetic patients have the nervous weakness in the nerves going to the foot. So even if they have a thorn pick, you don't actually feel it. The sensation is decreased. Likewise, the nerves going to the intestine also may get affected, so there may be weakness in nerves causing decreased movement. That's called constipation, or you have autonomic neuropathy. Some of these diabetic patients have increased motions also. Sometimes some medications, or always you have to try about some medications can also cause some medicines long term which are taking, like especially antidepressants, some other category of medicines can also cause this constipation. So basically, the most important thing is you have to check up with any other medical illness the patient is having, and also any medications, and you have to increase your fiber intake, water intake, and also regular physical activity at least half an hour to 45 minutes is a must. And also reduce the processed food, reduce like junk food and processed foods has to be reduced. If you say everything is normal, then when should you be alarmed? When should you be alarmed that you have to do something is going wrong? When should you be alarmed? The most important factor is a recent change in your bowel habits. Suppose you have been passing motion every day, then suddenly for the past 1 or 2 weeks or so, maybe 2 to 3 weeks, you're not passing motion every day, once in 2 or 3 days. And whenever this is accompanied with abdominal bloating and abdominal cramps and pain, then you have to be alarmed that probably something is wrong. You have to consult a doctor. But if your bowel habit has been like passing once in 2 or 3 days, and it is all or once in or 2 or 3 times in a day, that's quite okay to acceptable. And also, what is more alarming is the recent change in your bowel habits, especially by lasting for 2 or 3 weeks, more than 2 or 3 weeks, associated with abdominal bloating and cramps, and bleeding in the emotions and mucus, blood in the emotions and mucus. These may be some indicative or some sinister disease inside, so always better to consult your doctor and get the proper treatment.